Hello, welcome to today's episode where we'll be talking about contraception. We will provide you with detailed information all surrounding birth control, and we'll provide you with our expert knowledge, provide you with some stories, anything that you need to know to keep you informed to make the right decision, whether you're on a journey of starting contraception or maybe looking to switch up. Please stay tuned and hopefully we'll be able to empower you to make your decision. Okay, so Trudy, before we start talking about contraception, in your own words, how would you explain what contraception is and what are the different contraception available?
So, medically, contraception would somehow refer to the deliberate use of, say, a method or a device or even a medication to prevent pregnancy. This would be by sort of interfering with the process of conception or implantation. Now, the goal of contraception is to actually enable women, or in other cases as well, couples, to plan and space out their children according to their preferences and circumstances. Now, because of this, contraception has actually been used as part of family planning, and there is different contraception methods, and this could include the likes of barrier methods, which is quite common. So it's the condoms. There is also hormonal methods, which is what we will actually be concentrating on today. There is the use of IUDs, which we have mentioned previously. We've just touched on previously. There's also other fertility awareness methods, and also permanent methods that people use, like sterilization, amongst others. And normally, when it comes to contraception, the choice of contraception will depend on individual preferences as well as health considerations. So health factors can actually determine what contraception is best for you, as well as lifestyle factors. So there is a lot of factors to consider before going on contraception, just to make sure you're on the correct contraception. Now, in regards to the types of contraception, can you just in detail, Steph, tell us a bit more about the different types that there is, and maybe a little bit more about the type of contraception we'll be talking about today?
Okay, fantastic. So I'm going to list all the contraception here, in my preference, like maybe the most effective, the ones that are okay, and the not so good, So I'm just going to list it that way, and then we'll go into the ones that we're going to be talking about. So to start off, I would say the most effective one, as Trudy mentioned, is the sterilization. So we have like the female sterilization and the male sterilization. I feel like these ones are very effective because like there's a very low chance that you will get pregnant. I think that one story that I know that somebody got pregnant, actually, my friend recently told me, where someone got a vasectomy done, and basically it was on Judge Judy, by the way.
Really?
Yes.
Don't trust everything you read, don't see.
So the man took the lady to the court, basically because she was pregnant, and she was like, "There's no way like this can be my child because I had a vasectomy, How can this be my child?" And the lady was like, "But, I've not slept with anyone else apart from you."
You.
And they were in their 50s, so you can imagine. But when they did the test, it turned out it was his child, and he couldn't believe it. But apparently he had the vasectomy a while ago. And
where was it done? Was it in Turkey?
I don't know. I don't know.
Those are the questions we need to be asking here. Where was this vasectomy done?
Apparently it was a long time ago. And you know how vasectomy is reversible, but I know it's reversible by surgery, but I didn't know it could reverse on its own. So it was a bit shocking, you know.
It probably wasn't done properly, okay? There's more to this story.
I know.
Stay tuned, guys.
I didn't
we'll give you more about this story.
Yes.
We'll find out.
Yeah, I didn't really watch it, but that's what I heard. And yeah, but from what I know, these are like the most effective measures in contraception. And the next ones I will go with, I would say the contraceptive injection. So, which is like the I can never say this word, progesterone injection. So, which you have every 3 months, and I would say it's quite effective, probably like 99% effective. And with that one, yeah, some people opt for that when they're not very compliant with their medication. Like if you're someone that's not very compliant with like taking medications, that's when they will go for that. But the con about that is that it may cause like bone demineralization. So it's best to take like vitamin D or something with that. The next I will go with is the contraceptive implant. I think that is also no, I'll go with the IUDs and the IUS.
Yeah.
Those are the next one. Apologies, guys. Yeah, those are the next one that I would say they're quite effective as well. So the IUD, is the copper one, and which can stay in for like 10 years. So, you know, you're quite protected for a while. And the IUS can stay in for 5 years, which is also not too bad. So again, if you're someone that's not compliant, you may want to opt for that option. The next ones are, I would say, the hormonal contraceptives, which is what we will delve more into. So this include like the contraceptive implant, the contraceptive patches, the combined pills, the progesterone only pill, and then the next, those I would put in the middle, and then the next ones, which are an okay methods, are like the barrier methods, the male condoms, the female condoms, like the diaphragm, that sort of thing. And obviously the natural family planning, because that one you kind of like listen to your body and watch your cycle, and whenever you feel that is safe or not safe, that's when you may have sex or not have sex. So I will put those like at the bottom, basically. I mean,
because if you think about it, if you forget, say, to track your cycle, or if you forget to do your body temperature, then what happens then? Because you can't guess some of these things, you know? So
exactly, yeah. So I will put those at the bottom. The barrier methods, I mean, like, you know, they're also quite effective. Like, you know, they're 98% effective. I'm not sure if you've watched Friends, but you know, Ross, that's how Ross found out they're 98% because he got Rachel pregnant. So those are like 98%, but you may be the odd one out and then do get pregnant, but they're still quite effective if you think about it. 98% is a very high chance of preventing pregnancy. So if you're someone that don't want these hormonal methods, you may opt for the barrier methods. Yeah. Okay. So
one thing though, we haven't, I don't know if we have mentioned, Steph, have we mentioned the withdrawal method? Because that is one method that a lot of these young boys they call it pull-out method. They call it pull-out method.
That's what we used to hear back when we were young.
A boy says my pull-out game is strong, you know what kind of contraception he's using.
Run away.
So he's saying that he can basically withdraw the penis before ejaculation, but we know that. So for me, that is right at the bottom. That's a no.
Yeah,
that is right at the bottom.
Right at the bottom. Yes, guys.
It is a method that is actually, you know, it is a method that people use. It's called withdrawal method. But when you compare it to some of these other methods, if you're actually looking at using contraception the way it should be used, this one is right at the bottom of this pile, guys. Because the pull-out method, I have stories about the pull-out method. Some of my friends who have had children, before we were ready to have
Yeah.
children, have actually said, yeah, there was,
Oh
they were using the
no.
pull-out method. They said, oh yeah,
Yeah.
it was like, a few months after marriage,
Oh,
and we were not
yeah.
quite ready to like start, having children, start with a family. We
Yeah.
were using the pull-out method. So what happened? What happened? Exactly. So there is a pull-out method,
Yeah.
which is not something I would
I
recommend at
wouldn't, yeah,
all.
I wouldn't recommend that. No. No.
There's other methods that is available that would be suitable. So
Yeah.
guys, if you need to have these conversations with your healthcare provider, your healthcare professionals, get to know what other options there is available,
Yeah.
uh, aside the pull-out method. Okay.
Yes, guys. Okay. So now we'll talk more about the hormonal contraceptive because
Hmm.
those are like the common ones that most people use and you come
Hmm.
across that. Yeah. So I think we'll start off with that. So Trudy, I think we've already mentioned the ones that are hormonal.
Yes.
Yes.
Yes, we have. So,
Mm,
hormonal contraception, as we've said, is the use of what is basically synthetic hormones, and this is to prevent pregnancy. And this come in the form of it can come in the form of tablet, it can come in the form of patches, it
mm,
can come in different forms. But what we'll do is we'll start by talking about the tablet formulation. Only
yeah.
because I feel like this is actually a lot more common. There's a lot more
Yeah.
people who are on the what we call the birth control pills.
Yeah.
And as we said, we've probably just mentioned just briefly, there are different types of hormonal contraception, and even in birth control pills, there is different types. It's two different types. Now there
Mm,
is the combined pill, which normally contains both the estrogen and the
yeah.
progestin, and there's the progesterone only pills, which also are known as the mini pills.
Yeah.
Now, both of these will normally work by regulating the menstrual cycle, and this will normally suppress ovulation. Now, just to start with the combined pill,
Mm-hmm.
Steph, do you want to take the combined pill? Do you want to go
Yeah.
with this one? Hmm.
Why not? Yeah. So let's start off with the combined pill. So with the combined pill, as the name suggests, there's a
Hmm.
combination of
Hmm.
something. So this contains two hormones, which is the estrogen and the progesterone. So these are the synthetic hormones that mimic the
Hmm.
natural ones in our body.
Yeah.
And the way they work is that the pill prevents the ovaries from like releasing an egg each month.
Hmm.
And also it thickens your mucus. So let's say, for instance, a sperm was to come in you, it won't be able
Hmm.
to penetrate into the womb for it
Hmm.
to reach the egg. And it also thins the lining of your womb so that if an egg is fertilized, for instance, it won't be
Hmm.
able to attach onto the womb. It won't be able to implant itself onto the
Yeah.
womb, so it won't be able to grow. So that's basically how these like pills work and to prevent you from getting pregnant. And I would say they are over 99% effective if you use them
Hmm.
the right way. If you follow the
Yeah.
instructions, I think they are over 99% effective. So you might say, how would you take a combined pill? So it normally comes in basic terms. So some of them come in like 21-day pills. We usually have like a monophasic 21-day pill. So where you will take the pill for 21 days, and after 21 days, you have a 7-day period where you don't take the pill. So within the 7 days, you will experience a bleed,
Hmm.
which there's some which we say it's a period, so you will
Yeah.
experience the bleed. Yeah.
Hmm.
So one thing somebody might ask, so when do you start the combined when can you start taking the combined pill? So to be honest, you can start taking the combined pill like at any point in your menstrual cycle. But once you start taking on your first day, it's most effective. It's effective after 7 days. So before 7 days, you're not protected. But after 7 days, you are protected. So that means that obviously you're not going to get pregnant if you have like sex during that after 7 days. So if you do start on your on let's say on the first day of your period, you're protected. Starting on the 5th day of your cycle or before, that also you may also be protected. But if you start maybe after the 5th day of your cycle, you're not protected. Okay, that's something you need to be aware. So you still need to continue taking the pill for 7 days and use barrier methods at this point. Okay, but once you've taken it consecutively for 7 days, you are protected, and then you take it, as I mentioned, for the 21 days that the pill comes in. Then you get your 7-day free period where you experience your bleed. Yeah, so this is the 21-day pill. There are some people who might say, "Oh, but they may forget after the 7 days to start the cycle again." Yeah. And that's when there is, the everyday pill. We call it the ED. So I'm not sure if people have come across maybe microgynon ED. This is when you take the tablet every single day. So the 30 days. So it usually comes in like the 21 day of the active pill, of the actual pill. And then you have like the sugar pills, which is the seven tablets. So during this sugar pills, you actually experience your bleed. So if you're someone that for instance, like, you do tend to forget, or, you don't remember these things, I think it's best to opt for the everyday pills. Okay. Yeah. One thing I will say, if we are humans, we do forget sometimes to take our medications, sometimes I do that as well. But with the pill, I would say it's best to maybe set an alarm and take it like this. Take it the same time each day, because that's when it's most effective. These pills, they last for like 24 hours. So if you do miss the pill, if you do miss that window, you will not be protected. So it's best to take it same time every day, just to be on the safe side. Okay. Do you watch out for like the periods where you're allowed to either you have to miss a pill or start all over again. Okay. So I think with the combined pill, it might be 3 hours. So if you're within 3 hours of the time you take it, that's fine. You be protected. But if it goes beyond that, you're not protected. Yeah, that's when you may have to use barrier methods. Okay. So should we delve into the side effects now, or do you want to add anything else before I start?
Let's talk about the progestin only because the side effects of both of these are very, very
to be
similar.
Honest, yes.
So
yes.
I think let's talk about the progestin only pill, and then we will just get into the side effects, because we all know with medication there is going to be side effects, and normally what happens with a similar medication, you might get similar side effects. Now, in regards to the progestin only pill, also known as the mini pill. Now, I will refer to it as the mini pill only because this is something that I'm so used to, because
Everyone
a lot of patients come in and say, "Where's my mini pill?" So you know exactly what they're talking about.
It's true.
So for the sake of that, just to kind of make it easier for everyone, and also just because of what I'm so used to now, we will refer to the progestin only pill as the mini pill. It's also known as the mini pill, to be fair.
It is,
Yes. So the mini pill is actually different to the combined oral contraception pill, in the sense that it only contains, as the name suggests, the progesterone hormone, right? right? And this progesterone-only pill, or the mini pill, is normally suitable mostly for women who cannot take estrogen, normally due to, say, health reasons, or maybe they've got too much estrogen in the body, so they would rather go for something different. That's why this pill is normally given. Now, just like very similar to the combined pill, it normally works by thickening the cervical mucus as well. And also sometimes it could also suppress ovulation. Now, of course, by sort of thickening the mucus, it makes it, as we've mentioned before, it makes it harder for the sperm to reach the egg. Therefore, the egg is not fertilized, because we all know by now that once the egg is fertilized, then can you become pregnant. But if the egg is not fertilized, then we're good. Okay. And just to mention that the mini pill can also affect the lining of the uterus. And of course, what happens when that happens is that it kind of reduces the likelihood of implantation or fertilization. But as we have mentioned, as Steph has just mentioned before, to achieve the maximum effectiveness with any contraception, regardless of whether it's the mini pill or it is the combined oral pill, it is very important to take the pill at the same time every day. Now, the effectiveness of normally the progesterone only pill would normally depend on a lot of things, but just to also very quickly mention, part of what makes the progesterone only pill, or the mini pill, different to the combined oral pill is that it comes in a pack of 28 active pills. Now, unlike the combined oral pill that has 21 active, and then you have 7 inactive for the days that you're having the break, the mini pill normally usually comes in a pack of 28 active pills. And that means that all the pills in the pack will contain progesterone. Okay, so there is no inactive pills that don't have the hormone. So all of them will have the hormone progesterone. And normally, as long as you aren't pregnant, you can start taking the mini pill anytime. Ideally on the first day of your menstrual period, and then it's just a matter of taking it all through with no breaks whatsoever. So that is one of the key differences to compared to the combined oral contraception. Now, as we have just very briefly mentioned, it's very important that you take the pill at the same time every day. And Steph has also just mentioned as well what happens when you've missed a pill, or what happens when you've started it, how effective it is, how soon after you start it is it effective. Now, when it comes to the mini pill, it is a reliable contraception. Just like the combined oral, it is also very, very effective. It can be up to 99% effective in preventing pregnancy, but it requires precise timing. So you take it every day, the chances are higher of it working as an effective contraception method. Now, if you take it whenever you remember, bearing in mind this is a hormone you're introducing to your body, so your hormone levels are going to be haywire, right? So the likelihood of it being as effective as if you took it every day, because you're introducing this hormone to your body every day at the same time, the chances of it being as effective if you're not using it as precisely as you should will be lower. Okay, so it's very important to use to take the pills ideally at the same time every day. So as Steph mentioned, and we also always mention this to our patients, set an alarm on your phone. If it's maybe the first thing you take when you wake up, or the last thing you take before going to bed, set an alarm just as a reminder that, okay, take your tablet. And that way you almost will always take it at the same time every day. Now, I think it's also very important just to note that whilst the mini pill is a reliable contraception option for women, it may not be suitable for everyone. So
Yeah.
just because maybe the combined oral hasn't worked for you, or is not effective for you, or is not suitable for you, doesn't necessarily mean that the mini pill will now be the most reliable and most effective and the most suitable pill for you. So always consult with a healthcare professional just to determine the most appropriate contraception method. And this will
Yeah.
be based on a lot of things. There'll be a lot of health considerations, as we've mentioned before, as well as lifestyle factors.
Yeah.
Now, just a few takeaway when it comes to the progesterone. Just remember, consistency is key. So taking it at the same time every day. And also, this pill does not have estrogen. That's what makes it the mini pill. That's what makes it the
Yeah.
progesterone only pill. So unlike the combined pill, the mini pill only has progesterone. And so if you cannot take estrogen, people people will say women who are breastfeeding, for instance, they would opt for the mini pill. Okay.
Yeah.
And we did mention just briefly side effects. Steph, just tell us about the side effects of hormonal contraception,
Yeah.
basically.
Okay. So with all medications, there are side effects that patients do experience. I mean, everybody is different with regards to how they may respond to medications. So I'll start off with some of the common side effects that you may experience if you take these medications. So with the obvious is diarrhea or vomiting. And feeling nauseous. So with these medications, sometimes they will make you feel a bit nauseated, which is quite common. If you do vomit, especially within 2 hours of taking the medication, I would say please take the medication again, because that will mean that the medication have been expelled from your body, so you're not protected. So please bear that in mind. If you do have diarrhea, let's say about 6 stools in a day, and that could also mean that the medication has been expelled. So please do watch out for that. There are some minor side effects as well that you may experience. Let's say some mood swings, which I have heard a lot of patients do complain about, that their mood change whilst they are on the pill. And I think this is quite obvious, because there is some changes to your hormones, so that makes sense that you will have some mood swings. So please don't hold us to it when we do have mood swings, please. Okay. Yes. Also, one thing I want to know is there are some patients who also experience some breast tenderness. So you may feel a bit heavy, or it may be a bit sensitive when you do touch it. This is also quite common, quite minor as well, so nothing to be alarmed about. Again, it's to do with the hormones, so nothing to be alarmed about. You may experience some few headaches as well. Again, a bit normal. If obviously the headache does persist, please do see a healthcare professional to help you with that. And one thing that you will also notice is that it may have an effect on your period, where sometimes you may either have maybe your period may not be too heavy, and sometimes some patients say that they may their period is not as painful when they're on the pill. So it all depends on each patient, as they say. Or you may be the opposite, where you never know, maybe it does causes you pain, but most of the time some patients say that they don't experience the pain when they're on the pill. One thing I have also noticed is that some patients do say that it does cause some changes to their skin as well. So these are some side effects that maybe you may experience. But as I mentioned, these are all side effects that they do list on there, in the product leaflet. But each body is different, and it does not mean that you will experience it. We're just letting you know some of the common side effects that do occur. There may be some major side effects, but we will not go into that. We'll go into maybe some red flags to look out for and who can use the pill. Is there anything you want to add to? Like, is there anything, any side effects that the progesterone, the mini pill,
So
some side effects that patients may experience?
right. So as I mentioned, with in regards to the pills, whether it's the combined pill or the progesterone-only pill, most of them will have roughly the same side effects. Now, you've mentioned something, Steph, I think it's very important to mention this as well. When it comes to nausea and vomiting,
Yeah.
most of the medication actually have this as a side effect. So this is not
Yeah.
just special to the
Yeah.
hormonal contraception. A lot of medication have got nausea and vomiting as
Yeah.
the side effect. I suppose it's just because first of all you're introducing something foreign to your body, so your body is just
Yes.
a way of your body reacting to, regardless of what it is, it's a way of your body reacting to introduction of something new. So this is normally very common. You've also mentioned breast tenderness, but what I've also heard is that some women have experienced breast enlargement. Now, this might not be a
Oh,
bad thing
okay. Yeah.
for if it's intentional and you're thinking, should I
Yes.
book that trip to Turkey or should I? It's probably not a
Okay.
bad thing, okay? But again, it's a side effect either way. So it might be
Yeah.
something that is, some people might be uncomfortable with.
That's
Let's
right.
just be very honest here. It is still a
Yeah.
side effect. So it is, I know some women have reported enlargement of the breast whilst they've been on or whilst they've started the
Yeah.
pill, regardless whether it's combined or progestin. There's also been, and you've mentioned this, but also just to sort of like add to that point, when it comes to changes in menstrual flow, some people say that they've experienced that maybe their period is a little bit lighter, maybe a little bit heavier than usual, or maybe very irregular. Again, that
Yeah.
is one of the side effects of the pill. It can mess with your menstrual flow, not necessarily just your menstrual cycle, even the flow itself. So it might be maybe a little bit lighter than usual, a little bit heavier than usual, or you might not experience any changes.
Yeah.
Yeah, and now this might not be as significant, and it's not really something that is a given with a pill, and it's probably not something that has been, there's been a stamp on it, but some people have also reported weight changes. So some people have reported that they've gained weight whilst they've been on the pill. Now we will just very maybe shortly dive into that, but it is something that has been reported by
Yeah.
some individuals. Now, the reason I think we should speak about this under the side effects is because there is of course going to be different side effects with every different medication,
Yes.
and there is something we have in pharmacy. It's a way of sort of reporting any side effects that's probably not known. So when this has been reported by a significant number of people, then it
Yeah.
normally would warrant maybe investigation. Hence why we're saying this could be a potential side effect, but again, it's not significant because it's not necessarily been proven to be caused by the pill.
Yeah.
And also, just I think, lastly, the only thing I can think of is, I don't know if you've actually mentioned it, but there's been a few patients who've come into pharmacy and they've said that since they've been taking the pill, that their libido has changed. So maybe they feel less of a sex drive, or they don't. Basically, their sex life has changed, basically. Or maybe
Yeah.
it got better, but this is something that has been reported again. But I suppose when
Yes.
when you look at it, if it's going to cause things like mood swings, it could cause some of these things. So when you have a mood swing, you're not quite
Yeah.
100% yourself. So this might also cause an effect in some of these things like libido. But
Yeah.
as far as I'm aware, those are the most common side effects that
Yeah.
have been reported by patients, that we know, that we always tell patients to watch out for.
Yeah.
But Very, very rarely there's other side effects. I
Yeah.
don't know if Steph, you've heard this, but it could be it could be a serious complication of a contraception. But
Mm.
and again, just going a little bit on a different tangent here, but I've heard someone come to the pharmacy and said they don't want an IUD because they've been told, or they know someone who, whilst on
Mm.
the IUD, it punctured their uterus, like it punctured up.
Yeah.
So it is something that has been
Mm.
reported. Again, as I said, things, some of these side effects that we maybe haven't mentioned or we don't know much about doesn't mean it's not a side effect. So if you're
Yeah.
going through any, or if you're experiencing any side effects that you feel maybe this is getting in the way of life, speak to your healthcare a healthcare professional. Let them know
Yeah.
some of these things because they might need investigating. Because
Yeah.
again, science is forever evolving. You know, there's some things that
Yeah.
we know today that maybe 10 years later, 10 years ago, they didn't know. And 10 years later, they will be completely different. There'll be a lot more known about some of these things. So it's just
Yeah.
worth, if you say experience any side effect that's unwanted, getting in the way of life, report it, speak to someone, let them know what is going on.
Yeah. I'm glad you mentioned about the weight gain, going back that to
Hmm.
that one,
Yeah.
because honestly, yeah, as Africans, we
Hmm.
have big mouths, yeah. So I
Hmm.
just wanted to like basically tell you a little story. So anytime, let's say for instance, someone gains weight,
Hmm.
honestly, it's so bad. My, I'm not gonna mention names, but people automatically tend to say, let's say for instance, they see like a girl or
Hmm.
a relative that has gained weight,
Hmm.
they automatically say, I bet she's on like contraceptives.
Contraception. Hmm.
Oh my goodness. The number of times I heard this growing up.
Hmm.
And guys, I know Trudy said, like, some patients have reported having weight gain, which is true, but we
Hmm.
did look into that. So let's say, for instance, with the combined pill, because it
Hmm.
contains like the estrogen and the progesterone. So the weight gain, what they normally found out is that is the estrogen that usually causes like fluid retention. So it makes
Hmm.
you a bit bloated, make you
Bloated.
like, a bit blown up. That's why,
Mm.
you may look a bit, it may gain weight.
Hmm.
And the progesterone as well, what happens is that it increases your appetite. So not necessarily increasing your weight, but it increases your appetite. So
So you eat more.
you may find that you're eating a lot more than usual. So
Hmm.
which in turn makes you gain weight. So I think one thing people need to bear in mind is that whilst you're on this pill, you just need to develop a regimen. Like let's say for instance, eating a lot more healthier, going
Hmm.
to the gym, like exercising, just so that in case, you are experiencing increased appetite,
Yeah,
you keep your weight in control. But
that's it.
I don't think there have been any evidence to say that okay, these medications do actually cause weight gain, but
No.
they do
The
cause
science
increase in
behind it.
appetite.
Yeah.
Yes,
The
that's the
science
thing.
behind it makes you think of some
Yeah.
of these things.
That's right. That's
Yeah.
right. But I just wanted to chip in because in my household, I always used to hear, oh, anytime they see like a girl that is like has gained weight, they always say, oh, I
Mm.
bet she's unconscious, which is so wrong. I think we need to stop doing that. Like,
100%.
yeah,
100%. And I think, you know what, I'm glad you've mentioned it because we know that in an African household, it's almost like a girl is supposed to be a certain way, right? You can't
yeah,
be out there maybe having intercourse at a certain age. So it would
yeah.
be, the way it would come across is, oh, look at her. Look how much
Mm,
how much weight she's gaining
yeah,
now. At her small
honestly,
age, she's already started. Do you know what I mean? It starts like that,
yeah,
and it kind of, and honestly, it could be maybe you're on contraception. It could be maybe there's a lot of things that's going on. It could be different factors in life.
exactly.
So when you notice some of these things on say women, on people, basically, sometimes it's just good to shut your mouth. Okay,
That's
because you
it.
don't know. You don't know
That
what's
is
going on.
it.
Sometimes just mind your
Oh,
business. Drink your
that's
water, mind your
it.
business, because no,
Honestly.
like because honestly, in regards to people's health, there is a lot of causes. There is a lot of things that can cause a lot of
Exactly.
the
Weight
disorders, a
gain.
lot of conditions, things like that. Until you actually know what is going on with someone, shut it. That's it.
That's it.
Just
That is it.
mind your own.
Period.
Mind your own.
Yes. Fantastic. Okay, brilliant. So I think we've delved a lot into like the side effects, which is quite
Hmm.
important. Um, with the pill, we normally say anyone can get it, like even under 16-year-olds can get it. I mean, your doctor will not refuse you if you do
Hmm.
need like a contraceptive. I mean, it's better to be safe than so. Sorry, obviously they will encourage you to tell your parents, but they will
Hmm.
not tell your parents and that sort of
Yeah.
thing. So when it comes to like the pill, I think people say anyone can use it, but there are certain groups of people
Hmm.
whom the pill may not be right for. So I think it's important we do talk about that. Um, so should we start off with? I think we'll start off with the combined pill, so that
Hmm.
we yeah. Then we'll move on to like the progesterone if we need to.
Yeah.
So with the combined pill, um, as we mentioned, anyone can use it, but when it comes to certain patients, because of maybe some underlying diseases or because of
Hmm.
certain conditions, the pill might not be suitable for them. So I'm going to list some patients who the pill might not be suitable for. So if you're pregnant, the combined pill is not suitable for you.
Yeah.
Um, if you smoke and you're over the age of 35 years, unfortunately, you won't be able to go on the combined pill as well. Um, Even if you have not smoked in less than a year and you're over 35, they'll still not give you the pill because you're at increased risk. So
Hmm.
unfortunately, the pill would not be given to you. If you are also overweight or taken certain medications, they might not give you the combined pill because there are certain medications. Let's say, for instance, antibiotics, some
Hmm.
anti-epileptic medications, which
Hmm.
interact with the medication. So
Yeah.
they might not give you the pill. Um, but there's something that I wanted to focus on with the combined pill because of the estrogen. Yeah,
Hmm.
I usually say that because of the estrogen, it causes a lot of problems. So where you may not be, let's say, for instance, if you have some certain diseases or some underlying things that
Hmm.
it might not be suitable for you. So let's say, for instance, you have a history of blood clots.
Hmm.
Um, let's say, for instance, in the vein, or if you've had it in your lungs. So this is like DVT and PU. So if you
Hmm.
have history of blood clots, unfortunately, the combined pill will not be suitable for you because of the estrogen. I always blame it on the estrogen. um, and if you also have a history of like stroke, any cardiac diseases, um, which may basically now like the arteries and stuff,
Hmm.
the combined pill is also not suitable for you. If you're someone that have severe migraines, unfortunately, that is also not good for you. If you also have breast cancer or any gallbladder or liver diseases, unfortunately, these are all like risk to the medication, and you won't be able to have the medication.
Hmm.
So I usually just blame the estrogen. Estrogen for this because the estrogen is usually that causes these changes and causes
Yeah.
all these things. So if you're someone with these histories, please speak to your healthcare professional, because so that they will provide you with an alternative, such as I'll pass it on to Trudy so that she'll talk about the progesterone, the mini pill, because that's when the mini pill may be suitable for you. So who may not have the mini
Yes.
pill, Trudy?
Yes, that's all correct. What you've
Yeah.
said, and you've been so detailed, Stefan. I appreciate that. And also just something you mentioned that kind of leads to another point is in regards to the combined pill. Because of the estrogen in that pill, it can cause some of these some conditions as well. So we know that things like fibroids and even endometriosis are estrogen dominant. So this has somehow been linked to, of course, having too much estrogen. And of course, if you're adding more estrogen to your body, it's not going to do any favors, to say things like that. So there is also those groups which ideally I wouldn't recommend going on the estrogen. But when it comes to the progesterone only pill, which we have been which we have been calling the mini pill, just like the combined pill, it is not suitable for everyone. Okay, so it can be used by a lot of people, but it's certainly not suitable for everyone. So first of all, there's people who have allergic reaction to progesterone or any pills. So if you have an allergic reaction to a pill, maybe you shouldn't take the pill because it would not be suitable for you. And it could mean that maybe you're allergic to even some component of the pill, not necessarily the active ingredient or the main ingredient. So if you have allergy reactions to either one of the pills, it's not suitable for you. Now, people who have liver disease, women with liver disease, should not take the mini pill. So if you have a history of, say, liver tumors or just certain liver conditions or any liver disease, it's generally not a good idea to take the mini pill. So avoid the mini pill. So just like the combined pill, if you've had breast cancer, it's not advisable to get the pill or to be on the pill, regardless of which pill it is. So if you've had breast cancer, women with history of breast cancer, it's advisable to not take hormonal contraception, including the mini pill. Now, if you suffer from unexplained vaginal bleeding, it's again not a good idea to take any hormonal contraception before having that conversation or consultation with a healthcare professional. Now, again, just like the combined pill, if you have blood clots or say blood clot disorders, it is again not suitable for you or might not be suitable for you. So do have that conversation with a healthcare professional. Now, also it's worth mentioning that if you're pregnant, maybe you shouldn't be on the pill. So if you are pregnant, it's not really going to work. So it's worth mentioning that if you have,
it might
pregnant,
even be dangerous for the baby.
It might be dangerous for the baby.
Is decreasing the lining of the womb. So
that's it. So it can cause other things. You're right, like induced labor and things like that. So if you are pregnant, or if you've just found out you're pregnant, it's too late now to be on the contraception. So ideally, the contraception, whether it's the combined or the progesterone only, it will possibly not be suitable for you. So it's very, very important to have a conversation with a healthcare professional before starting on the mini pill, and in this case, any contraception method. So just evaluate what is best for you. Have candid conversations. Be as honest about your health history, family history as well, and you will get tailored a tailored consultation to you, because just because, and I say this only because it happens a lot in pharmacy, but a lot of girls come in and say, oh, my friend is on the Yasmin, can I also just get that because she's getting on really well with it. Look, your friend is a completely different individual to you. So just because that is okay for her, that is suitable for her, doesn't necessarily mean that that's going to be suitable for you. So you need to have your own consultation, and we need to look at your own health history, family history, your own health, because it being suitable for your friend doesn't necessarily make it suitable for you. And that's one thing that a lot of people think is okay, but it's not. A consultation is always necessary. This is in regards to any medication. Don't just think you can self-medicate, or you can use someone else's medication because you know them, or because, oh, look, like we live together, or I know everything about her, so we both have the same conditions. I'm asthmatic, she's asthmatic, so no, just because that is the case doesn't necessarily make it okay for you to or doesn't necessarily make it make a certain medication suitable for you.
Yes.
So just be very careful, guys, in regards to how you're getting your medication, who you're getting your medication from, and how honest are you about your health, about your history. Just be very, very honest about these things, just to get a suitable consultation and suitable treatment, basically.
Yeah.
So in regards to, and we always talk about this, and we have already just mentioned a few things, but there is a lot of myths and misconceptions surrounding the contraception. I don't know about you, Steph, but I've heard a lot of things. A lot of patients come in and they say all kinds of things. So what are some of the myths that you've heard about the contraception, or in this case, the hormonal contraception?
I think I'll start off with, let's say, for instance, a patient who have given birth and they're not too sure about like the pill. So I think some patients usually say that, oh, I can start taking the pill maybe later on and after giving birth, but then I may be protected. There are also some people that say that, oh, they don't need to take the pill after giving birth, because they're protected whilst they're breastfeeding or something. But let's just cut it short. So simply put, you can take the pill after you've given birth, but there's like a window. So let's say, for instance, you've given birth. After 21 days of giving birth, if you are not breastfeeding, you can start taking the pill, which will protect you. But let's say, for instance, you've missed that period, the 21 days, and you decide, okay, yes, I do want to go onto the pill. After 21 days, if you've gone past the 21-day period, if you start taking the pill, you're not protected. So you need to basically take that pill for 7 days until you're protected. Sometimes some patients get confused. They feel like, oh, because they've just given birth, maybe they're protected straight away. But no, sometimes your body can go back to its normal rhythm, like straight after giving birth. So do watch those things. So after 21 days, if you're not breastfeeding, yes, you can start taking the pill and then you are protected. If it's longer than 21 days, unfortunately, you do have to take it 7 days consecutive until you be protected. Yeah.
Glad
so
you
that's like
mentioned
one
that,
thing.
because I know someone, like this is a good friend of mine. And the worst thing is this. No, I won't say it. Let me just leave some information out. Let me leave some information out.
Oh,
so she had a child, right?
Yeah.
And then after giving birth, of course, she was breastfeeding. During this time, she wasn't, like, even when after that safe window, after the safe window where you can now be on contraception, she did not take any contraception because she was told by
When you're
some auntie.
I've heard it.
By some auntie.
Yes.
that
I've
whilst you're
heard it.
breastfeeding, that is already
You're protected.
contraception. You cannot get pregnant
I've
whilst
heard
you're
it.
breastfeeding.
Yes.
So my girl
Yes.
did not use
Oh
no
no.
contraception. Guess what?
She got
2
pregnant.
months later,
Yep.
she
Baby.
found out she was pregnant again. So guys,
No.
breastfeeding
Yes, I've
is
heard
not
that.
a form of contraception.
No, I've heard that numerous of times, like numerous of times. Yeah.
I don't
That
get
is
it.
not a thing. Yeah, that is not a thing. Like I heard that so many times. These aunties, yeah, these African aunties, they'll be giving you wrong information. Do not listen to them.
Go to speak to someone who, you know, who is
Yeah,
credited at talking about these things, you
yeah.
know.
Honestly,
I
the
mean,
number of people that get pregnant during like are straight after they've given
it's
birth, it's a lot.
it is
It's
a
a
lot.
lot.
It's a lot.
Yeah.
I mean, we're not saying don't listen to the aunties. The aunties are wise. They know a lot of things. But when you are getting
Yeah.
information or advice that you're not 100% sure about, shake your head.
Just
Like,
check
oh,
it.
auntie, yes, yes, I hear you.
Yeah.
But right after that, go seek proper advice. Go
Yes.
get
I
professional
agree.
advice.
Yeah.
And in regards to weight gain, we've just touched on it where we've said
Yeah.
that as much as, of course, this is something that has been reported by a lot of girls where they say that they have maybe noticed weight gain. It is
Yeah.
not. I mean, research suggests that weight gain is very minimal and is not necessarily directly caused by birth control pills. But as
Yeah.
Stephanie has mentioned, the progesterone and estrogen, the way they work, it can almost cause you to gain weight. So
Yeah.
that is, as much as it's a myth, it is not really, I won't call it a myth. It's a myth, but with questions, or it's a myth
Yeah.
in brackets, you know. So that's one thing personally that I've heard a lot about. And as much as I'd be like, I would want to say to the patient, no, that's not being caused by that.
Yeah.
It can cause that because of just the way they, you know, if you look at sort of the way some of these things work, it
Yeah.
can cause some of these things. So lifestyle factors will play a significant role in weight gain. So it's very important whilst you're on the contraception, just to have also a discussion about sort of lifestyle, you know, healthy lifestyle discussion, basically.
Yeah.
Yeah.
Yeah. I think my personal, should I say a personal myth, but basically, yeah, when I was when I was young, yeah, I didn't want to take the contraceptive pill because I had it in my mind that, you know, it increases your chance of getting cancer when you're older. So I didn't want to take it. Let me just put it out there, honestly.
Right.
So, but that was before, like, why am I putting my business out there? That was before I became a pharmacist.
We're doing the maths here, Steph. But again, I'm glad you're sharing that, because we know that is a myth. It's not something that has been proven by science. So,
but that was what was in my head. Honestly, I was like,
Yeah.
no, I'm not going on no contraceptive because I don't know. It was something that maybe I heard like the adults saying it.
yeah.
And it was just implanted in my head that no, if I take
They
it,
were
yeah,
saying
I'm gonna
it. There was a
increase
purpose that was saying it. So you know.
So I basically had in my head, I was like, yeah, there's no way I'm taking this. Yeah, if the risk of cancer is gonna increase, yeah, that indeed.
I get
Yeah.
that. I get that. No, but do you know, I'm glad
but
we're sharing some of these things.
yeah.
Yeah, because you know, you hear a lot of things. Maybe you even read it somewhere. You might have read you might have read it on a blog, and you thought, wait, hold on,
Yeah.
if this is going to cause this, I do not want it. So
Yeah, exactly. But you know, there is some slight truth to it because, like, again, I'm gonna
hormones.
pick on the combined pill because of
Yes.
like the estrogen, yeah. So there is a slight increased risk of like, you know, causing like breast cancer and like
yeah.
cervical cancer. You know, it's the estrogen. It's that hormone.
Yeah.
I keep pointing that out. Yeah, it's that
Yes.
one. So it just basically increases like your risk of like these cancer. But
Cancers,
but
But does
But
it cause the
there is,
cancer? Is the myth.
well, it says risk of developing, but we don't know.
Yeah.
But in some good news though, they said the combined pill actually decreases your risk of like developing like a womb cancer, like ovarian cancer, that sort of thing. So I guess that's the plus side, but there is some sort of like risk in
Yeah.
breast
Just
cancer. That's why I
what
didn't opt for it.
what I would
Yes.
recommend, what I would advise people is, whilst you're say on any of this, if it's the combined or the progesterone only, make sure you always go for checkups every year,
Yeah.
every so often, just to make sure everything is okay. It's very important when a doctor is calling you, or the doctor's PA is calling you, and they're saying we need to do a medication review, and you're like, I don't need it. No, this is why you need a
Yeah.
medication review, just to see first of all, have you noticed anything? Let's
Yeah.
do your blood test. Let's do all of these checks every year,
Yeah.
just to make sure everything is okay. So whilst you're on any if you're on any medication, it's just advisable, honestly, whether you're on medication or not. I always say it's advisable every year to get literally a full MOT. Get your blood
Yes.
test, get your blood pressure checked, get your weight, get your height, all of
Yes.
these things checked, because again, weight and height will help with BMI. We'll know some of these things when it
Yes.
comes to BMI. So just always, whilst you're on any medication, get that thorough annual check, just to make sure
Yes.
that every medication that you're on is safe for you.
Yes.
Yeah.
Yes.
I've heard a myth about the contraception, a few myths. Some of them we've already talked about, but one very significant one I've heard is that the contraception can actually cause abortion. Just like I think we've heard about, we talked about this when we're talking about the emergency contraception.
Yeah.
So I've heard that if, say, you got pregnant, then you took the contraception, that it will get rid of the, of the fetus. But
Yeah.
this is just a myth. So
Yeah.
if you are on contraception, it's not necessarily going to work as an abortion pill. There is pills for that. Now, as we said, it might not be safe to be taking contraception whilst you're pregnant because of what it could do, but it's not going to necessarily abort the child or the fetus. So it doesn't necessarily work as an abortion pill. But again, as we said, and we emphasize, it might not be safe for you to take whilst you're pregnant. So if you are pregnant, or if you find out that maybe you've missed the period or anything like that, just check with your doctor, and then you'll have a consultation about what to do next, or what is safe and what is not. But some of these things that you read and you hear out there are possibly just someone who is putting information out there to scare you, or just putting false information out there. So the only correct way to debunk some of these myths is just to have those conversations with healthcare professionals. The birth control does not protect against STIs, so that's another thing. I don't know, you probably have heard it as well, Steph. So especially young girls, when they come to collect their prescription for their combined, in this case, because it's very common, or the progesterone only, they're always like, oh, so does this protect me from STIs? Does it mean I cannot get any STIs? No, it doesn't protect you from STIs. So you might want to consider a barrier protection, especially if it's not with, say, a regular partner. So if you're worried about STIs, there is other ways to protect yourself from STIs, but the birth control pills are not the way to go about this.
That's right. That's right. Yeah. I think that we've touched on a lot of myths. One thing I also wanted to touch on was like some of the advantages of these contraceptives pill, because it's not just contraceptives that we don't just use these medications for just contraceptives. Well, you may notice that some patients may be on these medications, but it's helping them with something else. So although they do have like their disadvantages, there are some advantages. For instance, like one thing I did come across is that some patients do go on these contraceptives because it could help reduce acne, helps regulate their the period,
Yeah,
makes your bleed a lot more regular or
yeah.
lighter or less painful. So
Yeah.
as much as we've talked about some of the disadvantages of it, these are some
Hmm.
of like the advantages of taking like the pill if you are
Yeah.
experiencing. If you're like someone that experiences like pelvic inflammatory disease as well, you may find out
Hmm.
that maybe the pill might actually help you as well.
That's
So,
right.
yeah, with all
And
medications, you,
it's good that you mentioned that, because a lot of young girls are put on contraceptive pills, but not for the purposes of contraception,
that's
but for
right.
purposes of what you've mentioned. So if, say,
Yeah,
you're a young girl, you have a friend who's young, and you notice she's taking a contraceptive pill, she might not necessarily be
yeah,
taking it for contraceptive
that's
purposes.
right.
There could be other reasons. So again, it's that judging hand. We need to stop with that,
Yes.
because without knowing what someone's health is like,
Hmm.
what their health condition is, what they're taking medication for, you cannot really
Yeah.
be the one to judge and say, I can't believe you're on this, or let's just be very, very compassionate when
Yes.
it comes to health, basically.
Hmm.
Yeah. And also,
Okay.
it's things like fibroids, things like fibroids, patients
Mm,
are also put on some contraception methods just to
that's right.
help maybe shrink some of the fibroids and things like that. So you just never know why someone uses a contraception. But for,
Exactly.
of course, the reason we were talking about earlier is for the purposes of preventing pregnancy, but it doesn't necessarily mean that you can't use contraception for other reasons. So if someone is using it for other reasons, by all means, you've had a conversation with a healthcare professional, it's all good, and you're being safe. It is safe for you to keep using it.
That's right.
What
That's
is
right.
your take home message then?
My take home message for this episode, I would say, is contraception is a personal journey that every woman goes through.
Mm.
It's something that you have to take charge of and make your own decision. So if you're someone that you're starting a new contraception or you want to switch contraception, please go through it with your health professional, a doctor or a
Mhm.
pharmacist, so that they could go through all the checks that they need to do.
Yeah.
If you are someone that you're ready on the contraception as well, I would say it's important that you do go for your pill check every year. So this is really important. So they may need to do your blood pressure check only because some of these pills may increase your blood pressure. So they may need to do that. They may need to check your BMI, so your weight and height, so which is quite important. Check your smoking status because, as we said, with the combined pill, you can't take it if you're over the age of 35 and smoking. So
Hmm.
please do make sure that you go for your pill check um, if you are on the pill. If you are taking the pill and then you do experience any side effects, please do make sure that you seek for medical advice from a health professional as well.
Hmm.
And as we mentioned, it is a personal journey. So make sure that you make the right decision for yourself. So, Trudy, what would be your take home message for today's episode?
My take home message on today's episode on contraception is, firstly, if you're not sure what to do in regards to you've been taking a contraception, maybe you've missed a few pills, or you've maybe not started it because you've read somewhere that XYZ, all of these things. If you're not sure about what to do, first thing, honestly, just speak to a healthcare professional. Okay. And in regards to pill, if you don't know what to do, take it. If you say you've missed a pill, you've remembered a bit late, just take it and then seek that consultation with a healthcare professional. Okay. And during a period, maybe you're not sure what to do, where you've missed a pill, or maybe you've not started taking it, or you missed it, you took it, and then you missed it again. Basically, things have happened, and you're not quite sure about the pill. Just use another method of contraception, like a barrier protection, just so you are safe, especially if you're not ready for any unplanned pregnancies. and you're not sure about your pill, just use another method of contraception and get advice as soon as possible. Now, we have spoken about the hormonal contraception in detail. Now, whereas there's a range of choices for your contraception, the key is the key to getting the right one for you lies on understanding what you're using the contraception for, and also how consistent you're going to be with the contraception, and also just communication, just so you give as detailed and as honest information about your health as possible, whether it's the a combined oral contraception, or it's the mini pill, or it's even a long-term solution, which we have also talked about. Always consult a healthcare professional to find a method that aligns with your lifestyle and also with your goals. So make informed decisions and embrace the freedom to plan your reproductive journey. Now, I really hope that, if nothing, we have managed to debunk some of the myths. So if you knew everything there is to know about your pill, I really hope that we've at least offered some more information about some of the myths and misconceptions there is out there about the pill, be it the combined oral or the mini pill, and we have somehow given you a guide towards an informed decision as to what is best for you. Don't let misconceptions cloud your choices, but always seek guidance and also seek information that is correct. And contraception, let's not forget, is not a one-size-fits-all realm. Okay, there is diverse options that can be tailored to your needs, and this would be depending on your lifestyle or your health. There is a lot of different options. So if you're on contraception or you're thinking about going on contraception, let the journey be defined by accurate knowledge and also empowerment, because this is a choice, but it is not something that you have to be on. It's a choice that you have to make, whether you want to be on it or you don't want to be on it. And there is no right or wrong decision.
Thank you for tuning in today. We hope you enjoyed this episode. Remember, a healthy chat is a step towards a healthy life.
If you have any topics you'd like us to discuss, drop us an email at consultationroompod@gmail.com. Our Instagram is @consultationroompod. See you next week.